started your timer and here is your question. Right, so if you have read and understood, considering it is surgical pathology teaching, kindly tell me what would be your answer to this patient?
I will tell this patient that we have received his blood report, which is
Yes.
prostate-specific antigen, and the report is slightly raised for his age, but
Okay.
there can be several factors which might have led to this rise in PSA, such as
For
an
example,
infection.
yes.
For
Yes.
example, an infection, for a recent history of sexual contact, a previous recent history of instrumentation, or
Vigorous exercise. Okay, can you please tell me
yes.
what is the normal range of PSA? How would you comment on the level of this patient?
The normal range of PSA generally considered less than 4, but some texts consider it to be less than 2.5, but it changes with age. This level 9.8 is high, and it is
Okay.
considered in an intermediate range because the value between 4 to 10 is considered indeterminate. Above 10 is considered to be likely to cause by malignancy.
All right. Can you please tell me why should one take multiple biopsies in a patient?
In case of prostate cancer,
Yes.
the difficulty is that we cannot visualize the lesion. We cannot visualize the cancer. We only have an indication that malignancy is present because of the raised PSA, but we cannot localize and see where the tumor is. So in order to make sure that we sample the whole gland, we take multiple biopsies from 6 to 10 to diagnose the prostate cancer.
How frequently should they be taken?
There are different protocols. Previously, it used to be 6 biopsies, then 8 biopsies. Currently, 12 biopsies are taken. And in case if there is persistently high PSA on the base of a negative biopsy, then even 20 or 24 course can be taken.
Can you please tell me, according to the NICE guidelines, what is the actual procedure for taking the prostatic biopsy? How should it be taken? Yes.
For taking a prostate biopsy, there has to be an appropriate indication for the biopsy. Patient need to be consulted properly that why this procedure is necessary and how it will be done. One has to make sure that the infection in the urine, that if patient is taking anticoagulation drugs, that need to be stopped. Patient need to be given prophylactic antibiotics based on the local guidelines, and patient need to be given a clean enema before the procedure. And the procedure is done in either in lithotomy position or in lateral position. Initially, a local anesthetic is injected through the rectum in the periprostatic area. Then through an ultrasound needle, different cores are taken. Approximately 12 cores are taken from different areas of the prostate and sent for histopathology. After the procedure, patient is advised.
Sorry, I was listening very quietly. One important thing which they want to hear that you have missed, according to the NICE guidelines, I said. So there should be truth guided or
yes, ultrasound guide.
Yes, ultrasound guide. You did say that. I'm sorry, I missed.
Yes.
I was adding that. Okay, I'm sorry, I missed. Okay, all right. Right. Once you have taken the biopsy, kindly tell me how would you differentiate if the sample that you have taken is from the prostatic cell or from the rectum?
the prostatic epithelium, the prostatic tissue has glandular epithelium, and the rectal tissue will have a columnar epithelium. And
But you will use what to differentiate?
we
What
can do
marker?
immunohistochemistry
Yes.
stain on PSA.
Very good.
That can help differentiate between the two.
Yes. Okay. Can you please comment why PSA is not a reliable test?
PSA is organ specific, but it is not disease specific. It can
Yes.
be raised in cases of infection, in simple UTI or prostatitis. It might be raised following a masturbation or recent sexual contact.
Can you please tell me what are the blood tests? At least tell me 3 important blood tests which are important for the diagnosis of prostatic carcinoma.
The first is PSA. Then, in order to see the metastases, you need to do an alkaline phosphatase test.
Good.
And serum calcium, LFTs.
Very good. Okay. Can you please tell me what is the cause for a person to have a prostatic carcinoma?
There are no reliable risk factors for prostate cancer, but it tends to occur increasingly with increasing age. And there are certain family history.
Yes, family history. So in case of family history, what are the genes which are associated for the pathogenesis of prostatic carcinoma?
No, I'm not sure about the genes.
BRCA1-2 and
BRCA1-2,
MSH2, and there are many others. Can you please tell me how this gene mutation takes place, or how this gene mutation causes pathogenesis of prostatic carcinoma?
BRCA gene is a tumor suppressor gene, and in the absence, others an oncogene causing.
Yes,
I'm not sure about.
All right, this genes. You will read later and tell me
later
on. Please.
Yes, sure.
Can you comment on grading system? What are the grading systems that we use normally to diagnose or to grade prostatic carcinoma?
Okay, the grading systems are used to check for the degree of differentiation of a cancer. In case of prostate, a Gleason system is used, which include 5 grades from 1 to 5, and these 5, the most common grade and the second most common grade is counted. The 2 scores are added and represented in as 6 by 10 or 7 by 10, and that has prognostic value for the prostate.
Yes. Okay. And the total score is, how is the total score calculated?
By adding the 2 grades, the most common grade and second most common grade.
Okay. This prostatic carcinoma, what is the mode of spread of this carcinoma?
The prostatic carcinoma tend to spread by bloodstream as well as lymphatics. By bloodstream, it spread into the venous plexus and into the bones, and in lymphatics, it is spread into the iliac lymph nodes initially, and then paraaortic. And
all right. Can you please tell me? Can you please tell me? Right. Can you please tell me this prostatic carcinoma is known to be sclerotic? Can you, when it's a type of metastasis when it takes place, can you please tell me why it spreads to bone?
It spreads to bone initially because of its because of the venous plexus. Prostatic venous plexus is continuous with the vertebral venous plexus, so it grows from the prostatic veins to the vertebral canal.
And due to increased osteoblastic
activity, it
yes
to sclerotic lesions.
All right. Last question. Please, once you have diagnosed that your patient has carcinoma, what are the treatment options that you can offer to this gentleman?
The treatment depends on the stage of prostate cancer. The treatment options are active surveillance, radical prostatectomy, and radical radiotherapy. In cases of when metastatic prostate cancer, of hormonal ablation available, including BSO and other hormones.
Okay, can you please, I said last question, but then can you please tell me what is the role of bilateral orchidectomy in treating
The
prostatic
prostate
carcinoma?
cancer, the prostate cancer is stimulated by androgens. So,
Yes.
performing bilateral subcorrectomy leads to decreased metastases and help check the growth of prostate cancer. It doesn't eliminate the cancer, but it can slow down the progression of cancer in patient with metastatic disease.
Good. Thank you. And
Thank you. Thank you.
here is your question. Right. So if you have read and understood considering its surgical and administration, kindly
madam.
tell me what are you looking at? If you can identify 34, please.
Madam, it is omohyoid muscle.
Can you please tell me the attachment of it?
Pardon, madam?
Attachment of this muscle, please.
Madam, it is attached to the upper border of the scapula and to the hyoid bone.
All right. Can you please identify the next one? This is 32.
Madam, 32 is sternohyoid. Attachment is with the sternum and with the sternothyroid. Attachment with the sternum and with the thyroid cartilage.
31, please, next to it.
31 is the sternohyoid. Attachment with sternum and the other is with hyoid bone.
Okay, here above is 38, please.
Madam, this is thyrohyoid.
Okay, how many infrahyoid muscles are there?
Madam, there are deep muscles and there are superficial muscles and there are four
So,
muscles.
yes, 4 divided into superficial and deep. 2 superficial, 2 deep. All right, can you please tell me their nerve supply?
Madam, all of them are supplied by the ansa cervicalis C1 to C3 except thyroid, which is supplied only by C1.
Very good. Can you please tell me the action? What is the action of this
Madam, they
muscle?
basically depress the hyoid bone during swallowing.
Okay, deep to these muscles, there is one organ. I don't know if you could see that or not. Would you be able to, if you can see, can you identify?
They will be thyroid gland.
Yes. All right. Can you please tell me the parts of the thyroid gland?
Madam, there are lobes of the thyroid gland, the right lobe and the left lobe and the middle lobe connecting them.
Can you tell me the surface anatomy of the thyroid gland, please?
Thyroid gland is, madam, it is situated above the C4 cartilage.
Okay, good. Can you please tell me what is the blood supply of the thyroid gland?
Madam, it is supplied by the superior thyroid artery, which is coming from the external carotid artery, and it is supplied from the inferior thyroid artery, which is coming from thyrocervical trunk, and in 10% of the population, thyroid M artery, which is coming from the aorta.
In venous drainage, please, because blood supply includes both
Superior thyroid
arterial and
vein
venous.
and superior thyroid vein and middle thyroid vein, they range into the internal jugular vein, and the inferior thyroid vein, they range into the brachiocephalic vein.
Good. Can you please also tell me the lymphatic drainage of the thyroid gland?
Madam, they range into the prelaryngeal, pretracheal, paratracheal, and the superficial and deep cervical lymph nodes.
Good, thank you. Can you please tell me during deglutition, thyroid moves? Why?
Madam, thyroid gland is enclosed in pretracheal fascia, and this is attached with the and this is also attached with the hyoid bone. So when the digastric muscle contracts during swallowing, it basically pulls the hyoid bone, which pulls the thyroid cartilage and along the contents of the pretracheal fascia in it. That's why the thyroid gland moves.
All right. Can you tell me what else is the content of pretracheal fascia other than thyroid? Are parathyroid glands within are enclosed within the pretracheal fascia, or they are outside?
Madam, they are outside. I'm not sure.
Okay, we'll come back to that later. Can you please
Okay.
tell me what are the common conditions which can arise in a thyroid gland?
Madam, embryological conditions?
No, what are the conditions like benign, malignant, infection? What are the conditions or what are the diseases of
In
the
the
thyroid gland? Yes.
Okay, madam. Madam, there is goiter, and then there are different types of thyroid cancers which can arise from thyroid. And like, madam,
Can you
there
name
can
few
be
benign,
yes,
yes, few benign
the
conditions of the thyroid gland, please?
yes, madam, thyroglossal cyst,
Yes,
goiter, and thyroid adenoma.
yes.
That is not adenoma. And then the cancer disease like the papillary carcinoma, the anaplastic carcinoma,
All right.
and
Can you please tell me how would you confirm your diagnosis? If a condition is benign or malignant?
madam, we will do thyroid function test, and we will also do FNAC.
Are you familiar with the term triple assessment? What does it mean?
Yes, madam, this is basically history,
Yes.
examination, and then the radiological, the clinical examination, the radiological examination, and the history.
Which is one condition that cannot be concluded or can be ruled out with FNAC? Like if you do FNAC, in which condition it will not be conclusive, the result?
Follicular carcinoma.
Yes, yes. Right. Can you please tell me what are the most common carcinoma which spreads through blood of thyroid?
Madam, this is follicular carcinoma.
Okay. What about the papillary carcinoma?
It spreads through lymphatics.
Lymphatics. And another carcinoma which spreads through lymphatics. Which one is that?
Medullary carcinoma.
Medullary. Yes, very good. Which carcinoma is more commonly seen in elderly females?
Elderly females. Medullary carcinoma.
No. Right. Can you please tell me what are the most commonly injured nerves during thyroidectomy?
Madam, this is external laryngeal nerve and recurrent laryngeal nerve, and sometimes sympathetic cervical chain.
Okay. Once you have done thyroidectomy for your patient, what are the other than nerve? What are other complications that can arise? Sorry.
Madam, hypothyroidism.
And
Late complication.
these are one of the list. Okay. And hypocalcemia. Anything
yep.
else?
Yes, madam.
Like acute, if you'll see, so there is, once you have done, so bleeding, so there'll be, that is acute. So you can classify it in acute and the late complications, and you can tell me like that.
Okay, madam. Okay, madam.
Right. How would a patient present if there is hypocalcemia?
Madam, he will present with the tetany. There will be circumoral tingling along with paresthesia, and if it is a severe, so they will maybe carpopedal spasms.
Yes. How should that be managed?
Madam, it should be managed with 10% slow infusion of calcium gluconate.
It was exclusively on just thyroid, so that's why. Thank you.
Thank you.
Here is your question. Right. So if you have read and understood, considering this communication skills session, kindly begin.
Hello, I'm Dr. Muhammad, one of the surgical doctor working with Mr. Mann. I am calling for an advice, calling Mr. John for an advice about a patient. May I confirm who I'm speaking to?
Yes, I'm Mr. John. Please summarize your case.
Thank you. 44 years old female who had cholecystectomy 4 days ago. Now she is complaining of abdomen pain. And also I noticed that drain contains some bile. Clinically, she has some tummy pain, and also she has, but the abdomen is lax. She's not breathing right now. And also she's tachycardic and there is nausea. Also, there is investigation has been done to show that increased C-reactive protein and total leukocyte. And also we have noticed that the bilirubin is high.
Okay. So, what do you think is the diagnosis?
I think she is having a bile leak right now.
Okay. Okay. So what can be the possible sources of bile leak?
Could be due to leak from the cystic stump due to slippage of the cleavage, or it could be due to retained stone. Also, it could be due to common bile duct injury. Also, it could be due to accessory cystic duct, or it could be due to leak from the liver.
Okay. And what would be the management for this patient?
Okay, I'll start fluid resuscitation, antibiotic, and also I will do some ultrasound. I also will consider booking for Ercp.
Okay. So why the CRP is high for this patient?
It's most likely due to acute stress reaction due to the inflammation.
Okay. So what do you want me to do for this patient?
Actually, the Ercp is not available in our hospital right now. That we are hoping to transfer this patient to your specialty care right now. That is why I'm calling you.
Okay. Okay. So is this urgent?
Yes, for the fear of the peritonitis.
Okay. So what is ERCP? Can you please tell me that?
It's an investigation money for endoscopic retrograde cholangiopancreatography. It has diagnostic and therapeutic benefits, which delineate the source of the leak and also help for the stent.
Okay. And what antibiotics would you prefer for this patient?
I will follow the local policy hospital. I will consider give clavulanic acid, and also I will cover the gram negative. I will give gentamicin.
Okay. And what would be the complications of ERCP that you would counsel the patient's attendants for?
This can lead to injury to the pancreatic duct or the bile injury, and also can lead to perforations and bleeding, and also infection and sepsis.
Okay. So do you need to arrange with anyone?
For that, I can arrange with the bed manager for consider repartition of the patients, and also encouraging early discharge of patients.
Okay. So what could be the other causes of free fluid in the abdomen of this patient?
For actually, it can due to fluid collection, can be due to bile leak, or can due to bleeding,
Yes.
Okay.
or
Explain
can
more.
be due to pus infections.
Okay. So what is the patient's blood reports? Are they done? Have they taken recently or?
Actually, I have not this information right now, but I will recheck and inform you when I off the call.
Okay. Okay. And how would you manage the pain of this patient?
Okay, I'll manage according to the WHO protocol. I will start by non-opioid. I will give like non-steroid and anti-inflammatory or acetaminophen. If there is no response, then I will give the mild and I give like an opioid. If no response, then I will give her morphine.
Okay. Okay. Sure. So you can transfer this patient. If you want to transfer, what ambulance would you prefer?
What ambulance?
Yes. What type of ambulance?
What?
I'm not familiar with this actually.
So you can say, I'll come back to this question later.
But I will recheck and inform you.
Yes. And who would accompany this patient?
Actually, I will call my senior and ask him about that. Most likely, senior house officer will accompany him.
Okay. Thank you. You can transfer the patient.
Thank you.
Okay. He still has 1.5 minutes. Again, maybe you could have asked him to summarize it for you.
Okay. So can you please summarize the case again?
Can you summarize the discussion, please? Dr. Mohammed?
Yes, the subjects have been through for 4 years old female who underwent cholecystectomy 4 days ago now, complaining of the abdominal pain, and she is now tachycardic and not nausea.
No, the
Physically,
discussion
the
which has
abdomen
taken
is
place between you
relaxed.
two.
There is no peritonitis right now, but okay.
The advice
Right
that
now,
you,
the
yes,
patients might most likely have my leak, and according to advice, we will start fluid and antibiotic, and also I will monitor her doing serial abdominal examination if peritonitis. Then I will call you and I will transfer the patient to your specialty.
okay, thank you. Yes, can you give feedback?
Yes, yes, ma'am. So sorry, I asked many questions which were not there.
That's
but
okay. That's how we will evaluate, yes, and prepare each other.
yes, ma'am.
Yes, good.
So yes, ma'am. It was nice, ma'am. Very good.
No, I don't think so. He could have done better,
Yes.
but there are room for improvement. So it was nice. You said you'll manage the pain according to WHS protocol, but there is WHS. Okay, protocol also you can say pain ladder. Then you understand that gradually you are increasing. And then what type of ambulance you would need? Tell us now.
Yes, that was the blue lighted ambulance with equipments with resus IV drip set as well.
Yes, and you know that. And then one question she asked you, who would accompany the patient? You said you'll ask your senior, you will accompany yourself. Who else can be more trustworthy than you yourself to accompany the patient? So here, I don't think this answer is right. You will say you'll accompany yourself. You'll come with the patient. Yes. Any
And
other
some,
question?
ma'am, I can repeat regarding ambulance. I'm not aware of this. That's why.
Yes. Dr. Snell, can you please tell the blue lighted ambulance?
Yes, it's the blue lighted ambulance with all the
Sorry?
equipments.
Blue lighted?
The blue light.
Yeah, okay, blue lighted. Okay.
Can you repeat, Dr. Snell, again so that they can understand? They knew it,
Yes,
but they
yes,
have forgotten. Thank you.
yes, ma'am. It's the blue lighted ambulance. It has all the equipments for cardiopulmonary resuscitation and also the IV monitor if patient needs to be given some anticoagulants or like continuous medicines, then it can be monitored.
Good. Thank you.
Okay, thank you.
Any
Thank
other
you.
question which Dr. Muhammad you have missed? We can discuss now.
Dr. Snap, please write that in the group, this type of ambulance.
Yes.
It has been discussed in the group itself. Here is your question. Right. So if you have read and understood, considering the communication skills station, can you begin?
Yes. So I'll enter the room. I'll wash my hands. Hi, I'm Dr. Snehal, one of the surgical doctors. So may I confirm your name and relation with the patient, please?
My name is Mehta. I am the mother of the child who just came in emergency.
Yes, yes. Before we proceed, would you like to have a seat, please?
Thank you. Thank you.
So, yes, and I'm really, really sorry that you couldn't be contacted before because we all were busy with the child's care.
What
So
happened to
I'm
my
really
child?
sorry. Yes, yes. I'm here to discuss about it. But before we proceed, can you please tell me what do you know so far?
I know nothing. I just received a call and they said to come to hospital.
All right. So actually, your child was brought to the hospital by his father. Apparently, he fell from the climbing frame and injured himself.
Mhm.
So our investigation, the jelly scan of the abdomen, it showed that there is rupture in his the organ in the tummy, which we called as a spleen. And unfortunately, this is a very serious condition because it remains a threat to his life.
Is he all right? Is he going to survive?
Yes, I mean, this is a very serious condition, but
What do you
I'm
mean by
really sorry
serious?
and you couldn't be contacted.
What do you
Yes,
mean?
so I really yes. Actually, if there is a lots of bleeding going on, this condition remains a threat. But please don't worry. He's in very good and expert hands. He straight away needed to be taken up for the surgery to fix the ruptured spleen.
Is he
So I
going to be
really
alive? Is he going to be alive?
So although his condition remains serious, we hope that he recovers soon because he's in very expert and very
Then
good hands right now.
why you are not treating him?
Yes, the child has been taken away for the surgery, and we really apologize that you couldn't be contacted before. But the condition is serious, although he is in a good hands at present.
If
Explain
you are
what
here,
is-
who is operating?
Explain. Yes.
Yes, yes. So our very good doctors who are very good surgeons and senior consultants are operating right now on him. And I really hope that he recovers well, but the condition remains serious. You have to know that.
What you are going to do with that organ you were talking about, which is bleeding?
If it is bleeding a lot, then it needs to be removed. If it is not bleeding that much, then it can be sutured or a part of it will be removed. So after we remove this organ, it has many functions in our body, like many functions in our defense system, in filtration of the blood, in storage of the blood. So when this organ is removed, there is a chance for potential infections or for
Okay.
multiple organisms, for which we will give him certain injections before he is discharged. So after that, he will need to take long-term antibiotics as well for the risk of
Okay.
long-term infections. But please don't worry. We will not leave him like that. We will take a good care of him. And after he makes a full recovery, then only we will make plan to discharge him.
Will he be able to do his routine work like going to school or going to for playing or not?
Yes, he will be able to do all these functions once he recovers well. But at present, we need to focus on his medical care. Is it okay? Are you all right?
Yes, I'm feeling better now. How long is going to take?
So unfortunately, I will not be able to answer that question because your child is in the operation room and I will not be able to go in there because I don't want to disturb the surgical staff. But as soon as he is out, I will leave a message and we will call you. You can wait here. Also, I will leave my number with the nurses, and you can contact me anytime if you have any more questions regarding this.
There is a
So
question that the nurse was telling me that they are going to call the child protection services. I don't know what they are, but those people are why they are coming.
yes, so actually your child's health is the priority for us, and just to make sure that he is safe and this situation doesn't occur again, we have to follow a standard protocol. So I need to share this information with the authorities.
Do you think
And
do you mean that we are not good parents? We are not taking care of the child?
no, but when he was brought, I don't want to say like this. I really apologize if you feel so. But there is this standard procedure we need to follow really.
Good.
In
Routine procedure. Yes.
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 Okay, so
So just to make sure that
what they are going to do? Are they going to arrest us?
no, there is a consultant and a social worker involved. They are just going to do a routine checkup just to make that your child is in safe situation and this incident doesn't happen again ever.
Okay.
And please don't be worried. Yes, this is just a routine child protection services we follow.
Okay. Is there anything else you want to tell me or I need to know?
Yes, so I would like to sum this up. So your child was brought here. Apparently, he fell from a swings in the school, and he got this rupture in the spleen, that is the intra-abdominal organ in his left side of the tummy, which is a serious condition, and sadly it remains a threat to his life. Although he is in a good and experienced hands, he needs to follow certain care treatment plan for the same for long term, like vaccines and certain medications, we call them antibiotics, and
Okay.
also we will take a good care of him and we will make sure that he recovers well. We will take a full examination, and after informing the social worker and the general practitioner, then we will make plan to discharge. So we are here. Please don't be worried. We are here to help you and support you. So
Okay.
if you have any more questions regarding this, please let me know.
And you'll leave
Okay.
your number.
Okay, doctor.
with the
Thank you.
nurse.
I will also leave my number with the nurse. And thank you.
Thank you.
Just 5 seconds left. Okay, good. Right, thank you. Yes,
Thank
can you give feedback to Dr. Snail now.
I think she was good.
Yes.
She dealt with all the concerns which was raised,
Yes.
and she the summary she gave that was, I think, too much detail. She need to just focus on the important points which were discussed, and that was okay from my side.
Yes. Anyone else want to add anything?
I would like to say that let the patient attender speak.
Okay.
Why? Because
Yes.
Dr. Snehal, no, she was trying to explain, but if it would be better if we allow the patient attender also speak, so we'll confine our answer only to what the patient attender has asked.
Okay.
You know,
Right.
she was going in a proper flow, but just
Mhm.
I'm telling this for
Yes.
beneficial purpose.
For me, it was very good. She had the control over the patient's attendant, and she
Yeah.
had the control over the case as well. But when she had to explain, she said about the trauma of spleen, she said it depends. It can be sutured. Layman would not understand what is suture. Maybe you can say it can be repaired, or it depends. Once we'll open it, so maybe that explanation she could have done it in a more layman language. Just that, and
Yes.
rest it was okay. Yes, Dr. Beecher said maybe you can allow, because in the beginning there was little bit like overlapping of the questions and answers, but then it sorted out. So that's why maybe Dr. Beecher said. So that's all, because I thought that you could have explained it little bit more yeah, in a different way. Rest it was
Yes.
good. Did you talk about the vaccination though? The
Yes, ma'am. I
emphasis.
said
Yeah, that's what she spoke about the vaccination, but
Yes.
that has to be told after patient asking for any medication.
Yeah,
Patient
yeah.
then again.
Yeah, and there will be information to GP as well. So yeah, that as well. Yeah, but then okay, it was good, but definitely